Hi ladies and gentlemen, welcome back to BGS Clinics. In the first video on general examination, I discussed up to examination of lips and tongue. Now we move on from examination of the neck downwards. In the neck, inspect the infraclavicular fossa for deepening, which is one of the signs of wasting, and palpate the neck for enlarged lymph nodes. Well, strictly speaking, anatomically, infraclavicular fossa cannot be considered as a part of the neck. But then, without a little liberty, things would get too complex, isn't it? Alright. Then feel the skin. Is it dry or moist? Common causes of dry skin are dehydration, undernutrition, hypothyroidism, and advanced chronic renal failure. In shock, the skin feels moist. Skin also feels moist when high temperature due to fever is falling down. Then examine the hands in this order. The nails, followed by the dorsum, followed by the palm, and then test the grip strength. As far as trophic changes are concerned, I will discuss them in the class on peripheral arterial occlusive disease. I will talk on the rest of the findings to be looked for in nails now. Blue or purple nails suggest cyanosis. Clubbing means bulbous enlargement of soft tissues of terminal segments of fingers and toes. Clubbing may be caused by diseases of the heart, lung, or gastrointestinal tract. Unilateral clubbing may suggest aneurysm of subclavian or brachiocephalic artery or Pancoast tumor. Clubbing in a single digit may result from injury. Occasionally, it may be seen to be hereditary and sometimes no cause is found. Koilonychia means hollowing, giving the nails a spoon-shaped appearance, and that is caused by iron deficiency anemia. Splinter hemorrhages under the nails may suggest systemic vasculitis or infective endocarditis. Then look at the dorsum of the hands. Normally, the veins on the dorsum of the hands in a patient lying in supine position are visibly distended. Flat or guttered appearance of the veins suggests dehydration. Then look at if the metacarpals are visible. Are they visible in this hand? No, they are not. Don't mistake extensor tendons for metacarpals. Okay? See, these are tendons, not metacarpals. In well-nourished people, metacarpals are not visible. Prominently visible metacarpals suggest wasting. Wasting means loss of weight. Then turn the hands and examine the palms. What will you examine in the palm? Look at the color and contour of the palm. Pallor obviously suggests anemia. Erythema is seen in pregnancy, thyrotoxicosis, cirrhosis of liver, high output cardiac states, and rheumatoid arthritis. Palmar hollow is a normal feature. Palmar hollow basically results from the prominence of the thenar and hypothenar muscles. These eminences are lost with muscle wasting, and then the palmar hollow gets obliterated and the palm appears flat. So, a flat palm is a bad sign. Have a look at this palm. What do you find in it? Basically, What are you supposed to look for in the palm? Color and contour, right? This palm is pale. And how is the contour? It's flat. The palmar hollow is obliterated due to wasting of the thenar and hypothenar muscles. What else can you notice? In the skin at the wrist, it looks dry and flaky. That again suggests undernutrition. This patient was nutritionally severely depleted. She had undergone some major gynecological operation which later got complicated and led to severe catabolism. The patient unfortunately succumbed. Now are you convinced about the importance of general examination? By looking at this palm alone, you can guess the plight of the patient. This is the palm of a very sick and weak patient. You have to treat such a patient aggressively. And one of the components of the treatment is to improve the nutrition as best and as fast as it can be. Which route you select to achieve this will vary from case to case, although in general, enteral route is better than parenteral for various reasons. If, however, enteral route is not possible for whatever reason, then do not hesitate to commence parenteral nutrition. The bottom line is get the patient in a positive nitrogen balance as fast as possible. You need proteins to repair tissues. You need proteins to combat infection. How will you describe this palm? The color appears red, isn't it? So this is palmar erythema. And how is the contour? The thenar and hypothenar eminences are well formed. Hence, the palmar hollow is nicely maintained. So, nutrition wise, this patient is good. And then test hand grip strength. Objectively, it can be measured by using spring loaded dynamometer. These are a few models. However, subjectively, it may be judged in this way. Ask the patient to hold your finger or two tightly and then you try to slip them out of the patient's grip. Judge how much difficult or easy it is. So these are your fingers and this is patient's hand. If the patient can hold on to your fingers tight without allowing them to slip away, then grip strength is good. If you can slip your fingers out of the patient's grip with a little difficulty, then the grip strength is fair. And if you can slip them out easily, the grip strength is poor. Then examine the lower limbs for shape, edema and veins. Veins on the dorsum of the feet with patient lying down in supine position. Normally the shape of the limb should be conical like this, the left leg. Cylindrical shape suggests wasting. Wasting of the right leg here must not be due to systemic nutritional depletion, because if that was so, then both the limbs would have been affected simultaneously, isn't it? Then what could be the cause of wasting in this case? Look at the forefoot. What is the problem there? It looks gangrenous. So chronic arterial insufficiency was the cause of regional wasting in this case. Then examine the feet and legs for edema. First look for edema and then feel for it. Press firmly but gently with your thumb for at least 5 seconds. A pit depression caused by pressure of the thumb confirms edema. Test by pitting like this on the dorsum of the foot, on the medial malleolus and shin of the tibia. Okay? Remember these three sites to test for edema by pitting. Dorsum of the foot, medial malleolus and shin of the tibia. Note the consistency of edematous tissue. It is soft in cardiac, hepatic and renal disease. Firm in inflammation. In inflammation, tenderness will also be present. It is firm to hard if edema is long-standing with varying degrees of fibrosis of subcutaneous tissue, and that is seen commonly in filariasis. Also note how far up the limb does the edema extend. What do you mean by edema? Edema means collection of fluid in interstitial space. It usually leads to a circumferential swelling of the limb. Acute edema develops suddenly and is usually painful. Chronic edema develops insidiously and is usually painless, though there are few exceptions. If the edema is not gross, but the limb just suspiciously looks edematous, and when there is no pitting on pressure, then how will you confirm edema? So the situation that I am talking about is unilateral suspicious edema and there is no pitting on pressure. Measure the smallest circumference above the ankle and the largest circumference at the calf. Compare one side with the other. A difference between the two limbs of more than 1 centimeter just above the ankle or more than 2 centimeters at the level of calf suggests the presence of edema. And then look at the venous filling on the dorsum of the feet with the patient lying supine. These veins in this position are roughly at the level of atrium. Normally they are visibly distended. Flat or guttered veins suggest dehydration. So that's it in this session. We'll continue general examination in the next class. Thanks for watching.